Good afternoon, everybody. Welcome to today's Eno Center webinar. My name is Paul Lewis, and I am going to be hosting the webinar today on Toward Universal Access. This webinar is an overview of our most recent paper, Toward Universal Access, a case study in the Los Angeles and Puget Sound region, which is the fourth paper in our research report series examining the FTA Mobility on Demand Sandbox project in Los Angeles and the Puget Sound regions. That report is published and available for free download on our website, so I encourage you to check it out. But first, we're going to hear from two of the authors of that report. We're going to talk about how we examined and studied how the Americans with Disabilities Act, in particular, applies to mobility on demand sandbox projects. And mobility on demand projects in general, and what we learned from reviewing the pilot in Los Angeles and Puget Sound. Eno has created a set of recommendations based on this for transit agencies and public private providers on how to go beyond the ADA and improve access for all users. And so in this webinar, the report authors will discuss the study, our assessment, and our recommendations. First, we'll hear from Catherine Idzorik. Catherine is a PhD candidate in urban design and planning at the University of Washington. She was the 2020 Thomas O'Brien Fellow here at Eno and spent the summer with us and thus helped do a lot of the writing for this paper. And we'll also hear from Alice Grossman. Alice is a Science and Technology Policy Fellow at the American Association for the Advancement of Sciences. And many of you will know Alice as a former Eno employee. She worked at Eno for a few years up until this past summer before she got her fellowship. And so we've invited her back because she spent a lot of time working on this paper during and then after her employment. So we thank both the authors for joining us today. And just as a quick note on format, this webinar will be scheduled or is scheduled for 45 minutes. Catherine and Alice will present the contents of the paper and its recommendations, and then we will have time at the end for questions. If anyone on the line now has questions, please type them into the questions function on the GoToWebinar control panel. I'll then take those and then ask them directly to Catherine and Alice after their presentation. And as always, slides and a recording of this will be available on Eno's website within a few hours. So with that, I'm going to turn it over to Catherine, who's going to present the first part of the paper, and then we'll hear from Alice in just a few minutes. Catherine, go ahead.
Great, thank you, Paul. Can we have the next slide, Madeline? Great, thank you. So I'm going to start off by providing a brief overview of the MOD Sandbox program and then give some background on universal access requirements for transit service. And I'll be focusing specifically on regulations related to mobility on demand services. I'll also provide a little bit of background on the regulation of transportation network companies, TNCs, in the pilot project regions, and then I'll turn it over to Alice to talk about the details of the pilot. So the Mobility on Demand Sandbox demonstration program was launched in May of 2016. It provided $8 million in funding for pilot partnerships to test new ways of providing multimodal, integrated, automated, accessible, and connected public transit services using on-demand mobility tools like smartphone apps or shared mobility services. The focus of the program is really on the development of local partnerships, as well as the demonstration of solutions in real-world settings. Eno is part of the research team evaluating the partnership between Los Angeles and Puget Sound transit agencies who contracted with a TNC to provide first and last mile MOD service to transit stations near disadvantaged communities. Next slide. One of the explicit goals of the partnership was to find cost-effective approaches for improving equal access for individuals with disabilities. So why is this important? Well, according to CDC, there are more than 61 million US adults living with some form of disability. And one of the most common forms of disability is mobility impairment, meaning that people have serious difficulty walking or climbing stairs. And nearly 14% of US adults live with some form of mobility impairment. It's important to note that although we might talk about disability in terms of more general categories like mobility impairment, each disability is unique. The FTA encourages transit agencies to reach out to riders with disabilities to help guide decision-making in any kind of transit service planning. The agencies participating in the MOD Sandbox pilot did conduct outreach activities with target riders to better understand their transit service needs, and Alice is going to talk a little bit more about that and how important it is later in the presentation. Next slide. So I'll briefly describe the regulatory landscape underlying universal access requirements for transit services. Federal civil rights law prohibits entities from discriminating against persons with disabilities under the Americans with Disabilities Act of 1990, as well as Section 504 of the Rehabilitation Act of 1973. And under these regulations, individuals with disabilities must be provided with equal opportunity in employment, state and local government services, public accommodations, commercial facilities, and transportation. So as a civil rights law that applies to both public and private transportation providers, the ADA aims to ensure equal access to mobility for disabled persons, and it applies to all transportation services regardless of funding source. So the Rehabilitation Act of 1973, which preceded the ADA, was specifically directed at programs and services receiving federal funding. Title II of the ADA applies to state and local governments, and Title III applies to the private sector like businesses or nonprofits. Both titles enforce general non-discrimination, but the requirements for state and local governments regarding equal access to facilities and programs under Title II is more stringent than it is for private entities under Title III. So the ADA regulates the operation of transit service, which encompasses vehicles, facilities, and training for service personnel, as well as ensuring appropriate passenger assistance and customer service, providing rider information through accessible formats and technologies, and also ensuring the accessibility of public meetings, websites, and other outreach strategies. Next slide. Under the ADA, a private entity that provides services under contract with a public entity stands in the shoes of the public entity and is subject to the same requirements to provide accessible transportation services and vehicles. So in the cases where TNCs are providers of on-demand public transportation, the TNCs must comply with ADA Title II regulations, which is a title covering public entities, even as private entities, because they effectively stand in the shoes of the public transit agencies. So this extension of responsibility is important because the private sector is increasingly playing a role in shaping mobility options along with transit agencies. In 2016, when the MOD Sandbox grants were first awarded, there were no models for transit TNC partnerships providing wheelchair accessible vehicle service. So testing some pilots under this public-private partnership model was one of the motivations for the FTA to set up the MOD Sandbox program. Next slide. All right, so now let's take a look at regulations specifically related to demand responsive services. Transit agencies that contract for some or all of their demand responsive services with TNCs or other private operators need to ensure that individuals with disabilities are provided with an equal level of access based on 7 service characteristics, which are listed here. And transit agencies are required to monitor demand responsive services to ensure that they're compliant with the ADA requirements. Next slide. Providing mobility on demand as a public transit service creates a lot of opportunities, including improved service for people with disabilities and more efficient use of agency resources. But it also involves its share of challenges. Some of the coordination challenges that have been noted in recent research on transit and TNC partnerships include adhering to local, state, and federal accessibility regulations, and also requirements for workforce training, data sharing between agencies and TNC companies, equivalency of service assessment, and also access to apps for some customers with disabilities or for those with limited English proficiency. And pilot projects like the one we're talking about today give agencies and TNCs an opportunity to work through some of those potential challenges. Next slide. So now I'll just give a quick overview of the regulatory context in our case study regions with regard to both accessibility and TNC regulation. So just as some background, state or local laws can override the ADA if they provide more protection or greater benefit to individuals with disabilities. So in Washington State, universal access is protected under Title II of the ADA, as well as the Washington Law Against Discrimination, which defines disability more broadly than does the ADA. TNCs are regulated at the state level only with regard to licensing and insurance requirements. In Washington, cities, counties, and port districts have the authority to further regulate TNC service. In the Puget Sound, the city of Seattle and King County, which is the county where Seattle is located, they have an interlocal agreement for the joint regulation of for-hire vehicles. So one jurisdiction manages the driver's licensing while the other jurisdiction manages the vehicle licensing. And in these jurisdictions, per trip fees cover the costs associated with TNC regulation and enforcement. And they also support a wheelchair accessible services fund, which offsets the higher cost of providing WAV service. Next slide. Agencies in the Los Angeles region also adhere to the ADA Title II, as well as to the LA County Board non-discrimination policy. And statewide TNC policies are managed by the California Public Utilities Commission. The TNC Access for All Act was signed into California state law in 2018, and part of the goal of that bill was to develop regulatory oversight of TNCs, specifically as related to accessibility for persons with disabilities. The bill aims to increase on-demand mobility access for the disability community by requiring TNCs to provide accessible services through their app-based platforms. The CPUC requires annual reporting and mandates that TNCs must develop plans for accessibility, integrated services, and appropriate driver training. Similar to the Puget Sound region, a fee-based TNC Access for All fund is used to improve access to mobility services for riders with disabilities by helping to offset the higher cost of purchasing, operating, maintaining, and insuring wheelchair accessible vehicles. And with that, I will turn it over to Alice to talk more about the pilot project.
Great, thank you so much, Catherine, and thank you, Paul, for introducing us. I'm actually going to start off by reiterating a really important point that Catherine made partway through the first half of this presentation, which is that TNCs that are standing in for a public transit agency do have to abide by the same laws under the ADA. But in 2016, when the Mobility on Demand Sandbox started, there were very few partnerships that actually had a TNC standing in for a transit agency. And this project is actually no different. The TNCs are not standing in for the transit agency. It's supplementing service in areas that the transit agencies already had ADA paratransit availability in those areas. So while the ADA laws apply to the transit agencies and the service overall, there were absolutely no requirements under the FTA in this context for them to provide additional accessible service. So all the accommodations made were based on the project goal of trying to figure out how to provide better and equivalent service for people with disabilities in these types of partnerships where you have mobility on demand from a private company supplementing public transit, even if it's in areas that are already covered with paratransit. So with that said, from the very beginning, the transit agencies and the mobility on demand company were working around this overall goal of access for all people. And if you guys have been following through our set of 4 webinars and papers that Paul mentioned at the beginning of this, you would also be familiar with the fact that VIA was not the very first service provider involved in this project. And one of the reasons that LA Metro, King County Metro, and Sound Transit ended up switching over to VIA was because VIA was very accommodating in thinking about what kind of service they wanted to provide to people with disabilities, and providing the data that was related to being able to set performance measures for those goals and evaluate the pilot as it progressed through the first year, and now moving on to potential second year and service beyond that as well. So one of the ways that they were able to accomplish this and make sure that the partnership was strong from the beginning and they'd be able to work towards these goals was by signing a term sheet very early on before they even finalized the contract. Since the contract had so many different elements for it, if you go back and read our contracting paper, you'll see that that was a multi-year process. So signing this term sheet about service and data allowed for that planning process to begin very early on, and the agencies and the provider to know what was expected in terms of having an accessible service moving forward. There was also early engagement with the access services in Los Angeles who provide paratransit, as well as the King County Metro accessible services who provide paratransit. So getting that input from the people familiar with the areas and with those types of services was also something that they did very early on. They also, in both regions, ended up working with cities and counties to look at surrounding infrastructure. So when you're providing service for people with physical disabilities, it's not just the vehicle that you have to look at, but you have to look at the surrounding infrastructure. So are there curb cuts? Is there space for a ramp to come out? And then is it a side loading or a rear loading vehicle? And so all these considerations had to be taken into account very early so that the agencies could also collaborate with counties and cities to make sure that they had the pickup and drop off considerations, as well as the vehicles and the booking elements to be able to provide access for all people. Next slide, please. So the service elements that they ended up with were that they, in both regions, there were wheelchair accessible vehicles, waves, on the roads in all service areas at all times. And that made up a portion of the total fleet. Not all of the vehicles were wheelchair accessible, and that's true in both regions, even though in Puget Sound they had a dedicated fleet. In Los Angeles, drivers were bringing their own vehicles or vehicles that they were renting to provide this service. But they also decided in both areas that the cost was going to be equal, even if it's more expensive to provide a wave. Part of that equitable service was having equal costs. And so people were paying the same for ambulatory vehicles or wave vehicles, which in both regions was also equal to the cost of a bus ride, until in Los Angeles, they very early on made the service completely free for everybody, and that included the waves as well. One of the only differences between the two services was that wave service was point to point. Whereas if you requested an ambulatory vehicle, you might have to walk a little bit for them to optimize routing. And then also one element that we'll get to a little bit later as well is that the wave requests were binary. So things like point-to-point service might be something that some users need who don't necessarily actually need a wheelchair accessible vehicle. There also might be people who need wheelchair accessible vehicles who don't necessarily need a point-to-point service. But the way that we developed the app and the requests early on was that this was kind of just a binary, either you need it or you don't. So all of those were kind of packaged together in this one type of ride request. Next slide, please. Great. So how did we make sure that the service we were providing was working towards these goals of equitable transportation for people of varied physical abilities? We worked with VIA and the transit agencies and our research team to make sure that we were getting data that we could apply then to performance measures that related directly to those goals. And so we had data from the transit agencies, data from VIA on a ride basis, a request basis, and a driver and vehicle basis. We also worked with VIA to get comment data. Users can leave comments in the apps to be able to get feedback directly from the users as well. We put out a separate rider survey to VIA users that also asked about service perception and disability. And we had paper intercept surveys that we worked with the transit agencies to deploy at the beginning of the pilot in 2019 to ask about rider characteristics. And then the agencies worked with them themselves to also do focus groups with the disability communities partway through the pilot to get some feedback and increase awareness about this pilot moving forward. So next slide, please. We're going to look at the data. Excellent. So these focus groups, you can see in Los Angeles, for example, not only did they provide good feedback, but that outreach was really important. So you'll see that for the first 4 months of the pilot, there were actually no waive requests in the Los Angeles region. And let me clarify, this chart that we're looking at right now is waive requests in the Los Angeles region only. So once they started their targeted outreach in the summer, you see the waive requests do start to increase and actually gradually increase over the entire pilot. You'll also notice that there were kind of two different types of waive riders. There were some that requested only once. So overall, there were 96 unique user IDs, and 26 of those users only requested one ride. However, the majority of those users, and more than a quarter of those users, even to a higher extent, used the service multiple times. And 26 of those were what we might call super users, people who used it over and over and over again. So thinking about service provisions moving forward, that's one thing to consider. What are the trip purposes? Why are some people using this more often than others? Is it because some people use it to commute, whereas other people use it for specialty rides? Or are some people just having different experiences and don't find it as convenient, so they don't use it again? Being able to dive into this type of data helps the agency and VIA figure out how to improve and use this service optimally moving forward. So let's go to the next slide and look at the data in Puget Sound. So in Puget Sound, you'll see that they did have more rides at the beginning of the service that were waive request rides. The first bullet point there, the mean trip distance was slightly lower for waive requests, but that was actually only slightly lower. And I think it was less than half a mile lower than the overall mean distance, I think. But if you look up our paper, you can fact check me on that number. And you'll also see a similar pattern in Puget Sound that you kind of had two different types of users. You had these super users, which was a smaller portion in the Puget Sound region. There were 5 unique IDs that made up 2/3 of all of their waive rides. So there were a couple of people who found this service and they used it over and over and over again. So that's a very positive feedback in some ways, that this is something that people wanted to keep doing, but it also shows us that with more outreach, we can probably reach even more people to become super users like that for specific trip purposes and needs. All right, let's go on to the next slide and look at the performance measures. So at the beginning of the planning process, as I said, VIA and the transit agencies worked on a term sheet, and then once they finalized contracting, they put in these performance metrics, which they used as key performance indicators throughout the year-long pilot for the agencies and the mobility on demand provider to check in with each other. They also contractually agreed that these could be flexible. Again, this was kind of a never before done tried pilot, and this was the whole point of the Sandbox program. And so the idea is it's flexible. In the end, they didn't end up changing the targets. So we had some pretty good insights moving forward, as it turns out, and the agencies and the mobility on demand provider did a great job for the most part meeting those targets. One thing that you will notice is that actually the agencies set the same targets for waive rides and non-waive rides. So to that point, this idea of having equivalent service, maybe overall, you'll see that some of these averages, the average wait time and the average percent demand met, the overall percent demand met for the waive requests are slightly different. But these KPIs were set saying as long as that wait time is 10 minutes or less on average for all types of rides, that's the minimum service that we want to provide for everybody, and everybody should have the right to that minimum service level. And again, they came close to meeting those waive request minimum service. And actually, also the call center, they were very, very close to meeting that. But being able to measure this moving forward allowed us to look at those goals and sort of think about what is equivalent service and how do we get there and how do we reach it. Next slide, please. So overall, the lessons learned. One of the main lessons, and here I'm going to combine bullets 1, 3, and the last bullet, is engaging and learning with the community. So engaging with the disability community, learning about different types of disabilities. In the end, this report and this presentation really focuses on people with physical needs and physical disabilities. That is just one type of disability. So there's all sorts of different considerations, and that's not even one type of disability. There's lots of different mobility considerations for all sorts of people, including people who maybe don't have a physical disability, but at a time are carrying a lot of heavy things or have a stroller with them. So learning about sort of what all of the varying and different needs are can really help you provide a service that works towards this idea of universal access. How can we improve access for everybody? You have to know who that population is. And engaging with experts in the field of disability and mobility, as well as engaging with the disability community, are absolutely key to being able to figure out what all of those needs are. Another great lesson learned was that planning from the very beginning helped lead to a successful pilot. So allowing the agencies to work with other groups like cities and people who are in charge of the infrastructure, and engaging with access services early on and having those conversations from the beginning meant that from the beginning, rolling out the pilot, we had what we needed. But having a backup plan is also important. So one of the things that they did in both regions also was they worked with local taxi companies who have wheelchair accessible vehicles out on the streets and available. And they worked with these taxi cabs to say, if we have a really high demand for these waves and we don't have enough vehicles, can you be our backup and provide the rides so that we're not leaving people out in the cold without a ride? And while in the Los Angeles region, they didn't end up needing to use this backup, in the Puget Sound region, they did. So it was important that they had that backup plan, and they used it, and they didn't have to deny people rides. So that worked out great. Another important thing is setting these clear performance measures and targets and relating them to the project goals. It means that you can really work together moving forward and have measurable outcomes to see what is working and what is not working, and can we claim success in increasing access for people with disabilities or not? And how do we want to define equitable access? Is it calling 24 hours in advance for paratransit, or is it, which is what it is under the ADA, or is it that nobody is going to have to wait more than 10 minutes for an on-demand ride, which is what they said in this pilot. Beyond that, also, I guess this is part of planning, is training drivers. So making sure that you have the fleet, the infrastructure, but also the personnel to be able to handle the demand. So there's a lot of different elements here. And then lastly, also just budgeting liberally, because you never know what's gonna come up. So thinking about those things like, wow, are we gonna have to add in an extra curb cut here because our pickup drop-off zone that we're making actually isn't accessible, in which case doesn't matter if the ride's accessible, you've got to have every element moving forward accessible. So with that, I'm going to turn it back to Paul for questions for us. Thank you.
Okay, thank you, Alice. Thank you, Catherine. That was very insightful. Again, for those of you that are on the live feed right now, we've seen a bunch of questions come in, and I would encourage those of you that have questions to put them into the question function on the GoToWebinar control panel. We have an awful lot, and I'm going to get to as many of them as I can. I will note that a couple questions are coming in about some of the broader service all, like how much does it cost on a per ride basis? What is the overall ridership? Those kind of things. Those reports are forthcoming. We are in the final stages of wrapping those reports up. So please stay tuned and expect a webinar here in the next few weeks that will talk about how this fits into the overall picture. But I want to focus on some of the pretty interesting questions that are coming in, and one of them was, I thought, kind of an interesting one on a regulatory standpoint. So if a TNC, right, were to fully stand in the shoes of a public transit agency in a given area to provide some service, but it were also be continuing to operate its privately operated service or its normal service outside of that area and in other parts of the region, would that TNC and its operations outside of the transit area still be subject to the ADA or other regulations, or only in those operations that are paid for by the agency? Can you give a little clarification on how that would apply?
I can try to answer this question. I think this is, you may need someone with more expertise, but the ADA always applies to private entities under Title III. So they would, a private company like a TNC in its own operations would be subject to those requirements. And then as far as public services, I believe that if they're providing public transit services together with the agencies, they would then be subject to the requirements of ADA Title II. So I think as long as they're separate services, those two different titles would apply, but Alice, you might have a better read on that.
I would completely agree with what you just said, Catherine. And for those of you looking for examples, one of the very few examples in the country so far where we actually see a TNC stepping into the shoes of a transit agency is in the city of Arlington, Texas, where VIA has been was providing public transit in lieu of a public transit agency. So for those of you who are really interested in the nuances there, yeah, I would say you're going to have to dive into both sections of the law that Catherine just mentioned. But then if you want sort of an interesting case study and example, take a look at Arlington.
Got it. A couple questions about the data that come up, and you know, so I'm going to pitch these questions to you all, and if we need to follow up, I think that's okay. One question said that in this particular person's experience, that low wave requests often have to do with the fact that there's high denial rates overall. Do you have a sense for what the denial rate was on any of the either of these services?
Denial rate, I'm going to assume means that you request a waive but don't get a waive.
I think that's right, yeah.
So in traditional TNC services in a lot of cities around the country, not all cities in the country do TNCs even offer waives, first of all. So there are places that you could request a TNC through the app and waive is not an option. And in other cities where they do offer waives as an option, it is often a very long wait time. And sometimes, yeah, you end up not getting a ride, getting a match at all, or you'll get a match and then they end up denying you partway through. That's very different than what happened in this pilot. Because in this pilot, the transit agencies were making sure and overseeing that there were always waives on the road, the service areas. And if, again, you look back, I think at our report number 1 on contracting, you can look at those service areas. They were not huge. And so if there's a waive available in each service area, it might be a slightly long wait time. But the transit agencies worked with VIA very hard to make sure that there would always be an available ride. So if you go back to the performance measures, which you can also find in this report, that chart that I had on the second to last slide, you'll see that actually 90, yeah, you know, above 90% of all demand, of all requests were met. So that's a very different, that's one of the things that made this pilot more accessible than on-demand services where there is not that partnership.
Got it. And do you have a sense for what percentage of rides were provided by taxis rather than the TNC waves?
I do not have that number. It's something that we could check on, but it was okay. Not. It was only very early on, so it was something they set up early on since there was no way to model what the demand would be. And once we started getting data in showing what the demand was, we were able to cover that with the VIA service.
Got it. So another question at a little bit higher level in terms of the case studies is, there's a few questions actually about how the agencies specifically engaged with the disabilities community and other experts. Can you give a little bit of an overview of how that process evolved at the very beginning and during the pilot?
Sure. So originally the outreach in each region was structured a little bit differently. So in the Los Angeles region, VIA kind of took the lead on outreach at the beginning, and then the agency ended up collaborating a little bit more as they moved forward, particularly with the disability community when they saw, that flat line at the beginning of the chart that the waves weren't being requested. That was kind of a signal to us. And again, the importance of having these KPIs and the coming in, that, hey, there's this group we want to be reaching, and we were able to work with services to reach out to their customers for paratransit and say, hey, did you even know this service existed, and here's how you can use it, and what else might you need from it. And so that was done with mailers and focus groups and all sorts of different types of outreach. In the Seattle region, there was a lot of outreach from both the transit agencies and VIA to begin with, and you can see that again also when you think back to that chart, that there were wave rides starting right at the beginning of the pilot as well. So that sort of outreach and education was a little bit more broad right from the beginning, but they also did go back and did particular outreach and focus groups with the disability community.
Great. So the next question is coming from somebody who is in the research and development phase of an ADA and transit accessibility signs study for a few public transit agencies. And they're wondering, how did you approach obtaining permission to take surveys and obtain ridership and customer service information for those performance metrics that the pilots used?
So we took very much an academic approach, and I will say that this is the benefit of the way that this sandbox project specifically was set up. We're the only one, to my knowledge, that had a dedicated research team, which included Center for Transportation, UCLA, UW, and then University of Oregon also. And so with a bunch of experts who are used to dealing with personally identifiable information and data and surveys, as well as transit agencies that are very used to dealing with location and personal data, we were able to follow sort of, universal protocols that are generally accepted by the IRB review boards in terms of collecting and keeping that data safe, private, and confidential.
Got it. A couple questions about the workforce and how the pilots engaged with labor, particularly in the training piece. Was there any training involved with the drivers, and can you give a sense for what that looked like?
There was training involved with the drivers, and I'm going to kick it over to Catherine if she recalls the details of what that is, and if she doesn't, I'm going to point people towards the report. There's definitely a short section on that.
I am now unmuted. I don't remember the details. I would need to refer to the report as well.
Okay, yeah, we'll follow up on that specific question.
Sure.
So another question I think that's come up a couple times is, as agencies are looking to across the country to look into the implementing similar mobility on demand projects in their regions, what are some of the things that you took away beyond some of those lessons learned that we could point to in terms of specifics for community engagement and kind of designing this from the ground up?
You want to take the first stab, Catherine?
I mean, I think beyond the specific recommendations, I think building trust with the community you're working with is important. Part of what the pilot projects did was to work with the agencies that were already providing accessible transportation. So they were able to kind of co-brand and to approach the customer pool in a way that, you know, the customers, the potential riders, knew the agency that was approaching them. They were already in a trusting relationship and had accessed their services before. So that kind of partnership with, which fits under one of the recommendations, is to work with folks who are experts in the disability community. But I think that trust building is a really important piece.
Yeah, I would ditto that, and then also add the advantages of collecting data and monitoring as you go as well. So both of those are really important.
So a question here looks like from somebody who's trying to develop a pilot or something similar to this in-house. What different parts of the agency typically gets involved in the planning for this? Because you mentioned not only the operational piece, but also curb cutting and those kind of things. And does it sometimes go beyond the agency? And, you know, who are the stakeholders that need to be involved in these kind of discussions?
Many. So I'm looking now at my list of who the Office of Extraordinary Innovation, who ran this project at LA Metro, worked with. So they had to collaborate internally at LA Metro, also with the Civil Rights Department, who are experts in the ADA law and all of the technicalities behind that, which you saw are not always the most clear or straightforward. And they also worked with facilities maintenance and operations. They worked with different program managers. And then they also had to work with, the county as well. And so that's a lot of internal and external. And then in the Puget Sound region, all of the stations were not even necessarily within the city of Seattle. So they had to work with multiple city agencies as well to work on those pickup drop-off zones, and also had their interagency collaboration between Sound Transit and King County Metro, but then also, just as LA Metro did, working internally, not only with the innovation team that ran the project in Puget Sound, but also with all sorts of other internal teams at those agencies as well. So a lot of people, I think, is the answer there.
And would you say that continues not just at the beginning of the planning, but also throughout the whole pilot?
Certainly, I think largely it's a big lift at the beginning. It's a heavier lift at the beginning, and it will make it easier at the end, in the middle, if you do the hard work at the beginning. I think that's one of those lessons learned, that we did it right this time, and that's great. But if you don't do that engagement, and again, if you go back to the contracting paper, you will see that this was not a short project planning timeline. That doing the setup to get this rolling, it took a long time, and that's partly because there were a lot of people to talk to and collaborate with, but in the end, it paid off.
And then I know we're almost at 45 minutes past the hour, and I've just got a couple questions here that I think are a good way to close it. Is how do people get more involved? It looks like a couple of people want to get more involved in this process, either in their region or at the agency. What are some recommendations about just general involvement in these types of services?
I guess it depends on whether, if that's providing service or just learning more about it, or learning more about the disability community. Certainly, reaching out to agencies who are providing these types of services could probably point you in a direction, or to local organizations who are serving folks in the disability community. I think there are a lot of opportunities to learn more about what the services can provide, as well as the benefits of universal access more generally. So there's a lot of folks out there.
Yeah, and you know, on a national level, if you look through some of our citations or other reports on these topics and the organizations that they're citing, that's a good way to just see, you know, who are the organizations and the disability research organizations and advocacy organizations that have this knowledge, and you can get involved. And then also on a local level, that's something, you know, I'm not sure where this specific person or these people are from, but yeah, just take a look, Google, Twitter. Disability Twitter has a lot of wonderful, wonderful people and organizations who, if you get involved in that group, trust me, you will see plenty of opportunities to get involved. So, yeah.
Fantastic. Thank you for that. Yeah, I think that there's a lot of really excellent resources. And I want to say that there's a bunch of questions that I didn't get to, in part because they're referring to some of the topics that we're going to get to in future papers, including some of the data specific ones that are coming up in the papers we're going to release in a few months, or a few weeks. So please stay tuned for that. Really appreciate everyone joining us today. Special thanks to Alice and Catherine for their time and commitment to putting this paper together and joining us on the webinar today. And thanks everybody, and stay safe.
Thanks, Paul.